happening, there's an unexpected impact of COVID-19. Medics in the country are now warning that deaths from other contagious diseases could increase because a majority of Kenyans are avoiding hospitals. Children who are due for immunization are considered to be among the most vulnerable. Kadzo Gunga reports on the dangers of missing the hospital visits that have now reduced by up to 50% in some cases.
My name is Cheryl and this is baby Zawadi. So we came for the 10-month vaccine for meningitis. Yeah, and the reason I brought her is because I thought it's very important to protect our children. Even if it's not from COVID, we also protect them from the other preventable diseases.
Cheryl is one of the few mothers who have made it to Kilimani Children's Clinic today. She is here for her child's meningitis jab. On a normal day, this lobby would have been full of mothers and their children waiting for different vaccines recommended for boosting their immunity against many preventable diseases. But now, there is only a trickle here since the advent of COVID-19 in Kenya. Hospital visits in general have drastically dropped. Mama Zawadi confesses she was scared too by the thought of the potential effects of not receiving the meningitis jab outweighed her fears.
Definitely, as a parent, you're scared to bring your child outside. But you know, the clinic has a very good service where you just book and you go immediately and get the service. So you don't have to wait long.
Zawadi's cry signifying a step that could prove to be the real gift to the mother in the days to come.
So let's say you missed your vaccine at 9 months. At 12 months, you didn't come for the vaccine. At 15 months, between 12 months and 15 months, now you're at risk of developing the illness. And if you develop the illness, you're at risk of transmitting it.
Many parents are scared of possible exposure of their children to the infectious novel coronavirus following reports of increased community transmission. But health officials say adequate hygiene and sanitation measures are in place and the cost of staying away could be greater.
Compared to March, there is probably maybe 50% drop between March and April. We had fewer mothers bringing their children in March compared to April. We really need to take vaccination seriously because this is the single most effective way to prevent illnesses in children.
It is evident that a decline in hospital visitation has been recorded in the country following the coronavirus situation, but doctors affirm that hospitals are safe to offer any kind of medical attention to patients that need it. Kadzo Gunga, Citizen TV, Nairobi.